Welcome to the LDS Mental Health Podcast. This is a podcast for faithful women who want healing in their relationships, guidance from God, and internal peace. Each week, you'll hear mental health concepts taught through a spiritual lens from me, a licensed clinical mental health counselor, to help you start thinking in a higher and holier way. All right, I'm so excited to have Julie back on the episode this week. We're going to be talking more about therapy questions. So do you want to talk a little bit about what we did last week?
So last week we started diving into questions about therapy and kind of how to get started with therapy, what to expect at the beginning, things like that. If you haven't listened to that, you can go listen to that episode from last week as well. There's some really good answers in there that Nikki gave us because I think there's a lot of people who are not. I'm not in the world of therapy, so I don't know. I have a lot of questions about stuff, and apparently other people do too. So these are all questions that were submitted to Nikki from you guys. Yeah. So today we're going to do the same thing, but it's Therapy 102. So this is kind of after you've found a therapist, gotten into it, these are the questions that might come up after that. So
awesome.
Yeah. So do you want to just
Let's go right in? Let's do it.
First question, how often should I go to therapy?
So really, this should be a discussion that you guys have the first session. So you're talking about like what's the future going to look like with this? And the therapist should tell you like go make an appointment for this time. Typically, if you're coming to therapy, it's typically once a week that you're having therapy. Okay. I always say, and it depends on probably the therapist's schedule, their ability to get you in, how often they can get you in. I try not, if I can't see someone weekly, I try to close down my schedule and not see new patients so that I'm not like, well, I can only see you guys once every month or something. So this is my own personal like opinion on this, but if you're coming to therapy to receive help and you're not coming in weekly or at least every other week to start, it's hard to make progress. Because you're having so long in between sessions I feel like when people come back and see me after even 2 weeks, they're like, I forgot what we learned. I did good for the first few days, and then I kind of forgot what we were working on and what we were doing. Yeah. It's that accountability coming in each week that reminds you, like, I'm working on something. I really want to be doing this. I want to make these changes in my life. Yeah. It's kind of like, well, I want to lose some weight, so I'm going to eat lettuce once a month. Or I'm going to eat healthy, or I'm going to do these things, just every other day. It's not as effective if you can't be coming in.
Consistent with it,
Yeah.
That totally makes sense.
So I recommend at first, it's like, even if we do once a week for a month to get started and get some really good skills under your belt and really working on some things, I think we often back it off. Yeah. Do every other week or once a month or things like that.
Okay. So after you kind of come up with the schedule that works for you, how long does therapy usually last? Like how long are people generally in therapy for?
Yeah, I would say 3 to 6 months. 3 to 6 months is a good like guess on that. Yeah. It's really dependent on how much you're coming in with, right? Mm-hmm. If you're just coming in and like, oh, I just have some depression that's really getting to me, and we want to learn some skills, I would say 3 months is really a good amount of time.
Good time to learn.
Yeah. If you're coming in with some major trauma, or you have a couple things going on, right? That we want to work on the trauma, but we also want to work on your ADHD, or you also have anxiety on top of that. Like we may have an extended period of time of a relationship. I've had some people coming to see me for 3 to 4 years though. Yeah. And sometimes that's just like a monthly maintenance. Like they have an ongoing issue that's going to be with them for the rest of their lives. And so they come in for a monthly, just like, I need this time to come debrief with you, talk about this thing, and get realigned with what I was thinking about and helping with that. So it doesn't have to end with that 6 months or things like that. I think insurance companies are a lot better these days. They used to be like, oh, we only offer 6 sessions and then
you're just done. Yeah. And they won't pay for anything.
Yes. Yeah. But I haven't seen any insurance companies that do that lately.
Yeah.
Have you had that happen?
I actually haven't. No. Maybe they've done away with that. That'd be nice if they all did.
I don't know if that's a law now. Maybe they can't do that.
I hope not. Yeah. Because that's how. Yeah, one of my kids, he likes that maintenance. He likes going in, and he just feels really like that's his person. That's who he.
It's just a safe place.
Yeah, so he really likes just going in and getting that maintenance done every once in a while. And yeah, that's really helpful.
Yeah. So I think, and once you establish that relationship and you like somebody, it is nice to have that person there as that resource. So sometimes it's good to keep up to date with them, but you absolutely don't have to. So
yeah. All right. Yeah. Good to know. This is a good one. What are the different types of therapy?
Yeah.
Because sorry.
Wait. Yeah. No, that's great. Yeah.
Say there's a lot of.
There's many ways that we can help, right? And I think that it's hard to break it down and be like, here is the 10 types of therapy, because there really isn't. I mean, there's probably hundreds out there. Yeah. But there's general categories of types of therapy. I think the most common, well-known one would be like a cognitive behavioral approach, which would be like we're working on how our thoughts affect our behaviors. And so if I change my thoughts, then my behaviors will change. And so it's really about changing thoughts and reframing your thoughts, making them more positive, being aware of how your thoughts affect your life, and getting in there and changing it. There's a really good approach called dialectical behavior therapy. It was originally for people with borderline personality disorder, but it's really skill-based, and I like it for a lot of different things. I like it for teenagers because there's like different categories of skills, and it almost combines different theories. Like they have a mindfulness approach in there, they have emotion regulation, they have relationship, like conflict and relationship skills, and so and then under each of those categories are like 50 different skills that you could learn. So you come in and you are, and then crisis management is another one. So if you're dealing with crisis a lot, that's really helpful. So if you have someone who is maybe suicidal, that crisis management is going to be really helpful, getting some of those skills and helping them. Or someone in conflict or relationship, some of those skills can be really helpful. So I've been trained in DBT, and I like a lot of those skills. I think they're really helpful. But there's not a lot of, like, if you go out and look for someone who's trained in DBT, it's not as easy to find someone that's trained in cognitive behavioral therapy. Yeah. So it's not as widely trained. One that a lot of people hear about for trauma-based is like EMDR. But there are many other therapy or trauma therapies out there that work. The modality I use is called mind-body bridging, and it's evidence-based for trauma as well. And so EMDR is just kind of I don't know if buzzword's the right word, but it's the one that most people know. When they're like, trauma, you should see an EMDR therapist. It's great, but it's not for everyone. EMDR is going back and talking about the trauma over and over again and resensitizing your brain. If that's not for you, if you're like, I don't want to talk about the trauma, like the modality that I use, we don't have to go back and talk about that specific trauma to heal it. We talk about how it's currently affecting you, and we heal it through that line. Okay. And so there's other ways to deal with trauma in that way. I would say that kind of the newer approaches are more in like the mindfulness category. So like there's ART, the mind-body bridging, just any like meditation, mindfulness. That's more about being aware of your thoughts and diffusing them. So not changing them, but not having those thoughts affect you anymore. So like if you have a bomb and you take the fuse off of it, like it's still a bomb, but it can't blow up anymore. Yeah. So it's like taking that fuse off of your thoughts. Those thoughts can't blow you up anymore. I like that. Right? Yeah. And there's another called acceptance and commitment therapy. It's kind of a mindfulness approach. It's like accepting and committing to your thoughts are your thoughts, and that's okay, and they don't define you. They're not facts about you. Yeah. And how do I just not have them like cause so much tension in me or anxiety when they pop in my head? Like I can have these thoughts pop in, and like probably the most widely known approach, like have it float away on a cloud. But that's not like, well, how do I make my thoughts float away on a cloud? Like there's tangible like tools to do that, and that's what a lot of the modalities teach you to do is just have that peace, internal peace and calm when the external is chaotic. Yeah. Yeah. Okay. Very cool. Yeah. And I guess there's the other ones that on here too there's couples and family therapy too as well that, so I don't specialize in family and couples therapy. So I tend to say I don't I don't do couples therapy, or I don't do family therapy. I'll work with you individually, which can help your family, which can help you as a couple. But you can call your insurance company or look at Psychology Today and put in specifically couples or family therapy. And there are people who specialize in that. Specifically, someone who has a master's degree in marriage and family therapy. Like that was their whole degree, that they focused on that. So it is good to see somebody who might specialize in dealing with more than one person in a room at a time with that. And I think the last one would be play therapy. Kids under probably, I would say 8, maybe 6, aren't real great at learning skills, remembering skills. So sometimes I'll have parents come in and we'll work on a little micro skill, and I'll teach it to the parent or have the kid teach it to the parent. And then having the parent reinforce that every day at home is more beneficial than me teaching the kid what, and usually they can only do about 30 minutes in a session in the week, and then they're done. So I like to involve the parents so that it's reinforced with that. But play therapy can be effective in like sandbox play therapy, where we can see what a 2-year-old's thinking and feeling by the toys they choose to play with, how the toys are interacting with each other. Like, it's a whole certification that you have to get to figure out all of those things. So those can be really helpful if you have a younger child as well.
Yeah, for sure. Definitely. All right. So what if I'm in therapy and I just don't feel better right away? What should I do?
I would say that's normal. That it's not... There are some skills that you can feel symptoms being relieved, right? But not all modalities just like take that weight off your shoulder. You might feel like, oh, I'm so glad I talked about that. I feel a little bit better. And you might go home and something might trigger you back again. And you're like, why is this bothering me again? I thought I felt better about that. And so being patient with the process. I also say that anything that comes quickly is not going to be long lasting. Anything that comes slowly is actually long lasting change. Yeah. So actually the slower that you can do something, the longer lasting that's going to be. Yeah. So small and simple things bring great things to pass, like the scriptures say. So I would talk to your therapist about that. If you're feeling anxious about not having that change come quickly, that's something that you want to work on in therapy. That's something you want to talk about. And that might be the root cause of other things in your life. That does that affect your relationships when other people don't change quickly, when other people don't do things that you want them to do? Yeah. Then we can gain some skills around things not happening quick enough for you, so that you can be in that place to feel okay if things aren't the way you want them to be. Yeah. And should be.
Perfect. Well, that's good to know. Yeah. Mm-hmm. That's awesome. So if I have some sensitive topics, how should I bring them up to a therapist?
I think this happens a lot with trauma, in that you don't want to relive that. You don't want to talk about it. It's very personal. It's vulnerable to talk about those things. And a good trauma-informed therapist is not going to push you to talk about things that you feel uncomfortable with. The mind and body will close down and not let you talk about some things. Like your brain will just go blank. You will kind of feel very uncomfortable. And so I always say, like, we have to work with the outer layers of like the onion, right? We got to peel away the outer layers so that we feel comfortable kind of getting to that. And so if you're still feeling that resistance to do that, that's okay. Maybe, and you can tell your therapist, like, there's things I want to tell you, but I just don't feel comfortable yet. And they can help get you some skills to feel comfortable. Mm-hmm. But I would never push that person to tell me something they don't feel comfortable with. Yeah. It doesn't necessarily mean it's something about the relationship in general that you don't feel comfortable with that person. It's just hard sometimes. Yeah. But telling your therapist that you feel uncomfortable can help them get you some skills, or if there's something that they can do that helps you feel more comfortable in talking little bits about it. Yeah. You can do that.
I like that. They said, like, tell them you feel uncomfortable about it. Because, yeah, I think if it were me, I would probably just fester with it and be like, I need to say this, but I don't know how to bring it up, and I don't know what to say. And so that's a good idea to just tell them, say, I feel really uncomfortable saying this, but yeah, and having them help you do it. So that's fine.
Yeah. I mean, that's what we do. A lot of times people feel really uncomfortable crying in my office, and I'm like, man, that's what this room is built for. Like, like, that's what I'm supposed to do, is listen. Like, that. I think it's a good skill. Crying is a skill. Like, I think getting that out and relieving that pressure and being able to do that. And so sometimes people are like uncomfortable because they don't want to cry.
Yeah.
And so I'm like, no, that's what we do here. We all cry.
Let it
Like,
all
it's
out.
good. Yeah. Crying's good. It's cathartic. It helps you get that out. And so sometimes it can be like, I don't want to talk about it because I don't want to cry, you know? And if
Yeah.
it's like, I'm on my lunch break and I don't want to go back to work after I've been crying, then maybe we can talk about doing a session at a different time
Yeah.
and
Oh, that's a
helping
good
you
idea.
feel more comfortable with that, or find a time where you can take the afternoon off and go home and just rest and relax
Yeah.
after that and feel like you're going to be
Smart.
talking about that.
Yeah.
And sometimes people will say, oh, I don't want to go into this today because I need my energy for this afternoon, and I don't want to like feel drained after this. Like,
Yeah.
you can feel drained after therapy, like talking about things and getting that out. Like,
Yeah. That's a lot.
it can be a lot to
Yeah.
talk about. So
Such good information from Nikki Olson. I like this more because, I think I'm more of I just do kind of what I'm told type of person, like a
Yeah.
doctor or therapist tells me, but to have more of an open conversation like, hey, this is really hard for me. Hey, this is going to make me cry a lot, so can we reschedule? Like, I wouldn't have thought of that, so that's really smart.
yeah.
That's really smart.
One thing that I thought of too that sometimes people will do is like you're feeling really uncomfortable, and then it's like 10 minutes left in the session and you're like, I've wanted to say this all session, and then you might bring it up and the therapist has a whole schedule they've got to keep with.
Yeah,
Right.
yeah.
And so they may say, that's a really good thing. Can we talk about it next time? So if you really want to talk about it, you need to bring it up at the beginning of the
Yeah.
session, because they may not be able to reschedule everybody. There's somebody sitting outside waiting
Yeah.
for them to come in. And so if you do really want to bring it up, you want to do that, please do it at the beginning of the session so that they have the opportunity to help you with that.
Yeah.
And you didn't bring it up and then you have to wait a whole another week to talk about that. There is kind of a time constraint with therapists. They're keeping on that. So
Yeah, and you don't want to wait till last minute. You finally get brave enough to bring it up, and then you can't
Right.
talk about it, but then you also have to bring it up the next week, and you're like,
Yes.
So that's smart to just do it at the beginning, for
Or
sure.
you can tell them at the end of the session, let's say the session's gotten to that point and you say, I really wanted to bring something up today and I couldn't. Next time, could you help me bring it up at the beginning of the session? So you don't have to tell them,
Yeah.
but then you're kind of warning them, like, please help me, please remind
Yeah.
me, and we have notes, like I'll put in my notes, like wants to talk about something specific. And I always look at my notes prior to someone coming in, like, what did we go over last time? What did we talk about? Just kind of refresh my memory, because we're talking about lots of people and lots of things. Like, so we write those things down so that we can remember
Yeah.
with that.
Yeah, that's so smart. Oh, so smart. All right, what if I get into a therapist and we're just not vibing? What do I do if I want to change therapists?
Yeah. So in last week's episode, we talked a little bit about, what was the question? It was, what if you don't fit with your therapist, or
what
how
if
does it?
you,
Yeah.
something like that.
Yeah,
Where if
yeah.
you just want to change.
Want to change with your therapist. But so we talked a little bit about, like, if you're not feeling comfortable, or you don't feel like your relationship, like you can talk with each other, or their modality doesn't work, like what, those would be good reasons to change. Right. And so how do you do that? And we talked about, like, not ghosting your therapist in that, like, having an appointment, not showing up to your appointment, right? Like, if you have an appointment and you don't want to go next time, cancel the appointment so that somebody else can have that appointment. Like, it's okay to just not make another appointment and not come see that therapist. But sometimes you can talk to them about those things and see if that is something they can change. But if it's just like their personality, and you're like, I just don't feel comfortable with them, just don't make another appointment and then go look for another therapist. Ask around. Kind of last week we talked about ways to find a therapist, so you can go back and listen to that episode and talk about those. But if you've had a long-term relationship with your therapist and you, like, there's something that you've been wanting to work on, but you and it hasn't really been working, and you wanted to talk to them about that, like, do you have any really want to work on this specific thing, then do you have any recommendations of somebody who could help me with that? You could talk to them about it in that way too, as well. Like, I can imagine someone coming to me that's maybe going through a faith transition or wanting to leave the church, that could probably be really difficult to maybe want to talk to me about. And not necessarily because I have talked to people about that and I've helped them through that, and I in no way like shame or tell them that that's wrong or anything like that. But I can imagine you maybe somebody would want to go see somebody who specializes in something like that, and that's okay too. So being able to talk to somebody else about a specific issue is totally fine. And if you want to talk to that person about it, great, but you also don't have to. Like you're not obligated to this therapist in any way whatsoever.
Why?
Yeah, for any reason whatsoever. When you go to a new therapist, they're probably going to ask you if you've been to therapy before, and they may ask you to sign a release of information so they could get some records from that previous therapist to see what you did work on. And you have the right to say whether you'll sign that release or not. You don't have to have them go talk to that therapist. And they may not always do that. There's not always a need to do that. So when you go see a new therapist, you could say, hey, I've been working on this, and this is what I always say, like, what worked in your last session with your last therapist and what didn't work. So I have an idea of what they like and what they don't like, what was helpful, what wasn't helpful, and that will help you know if that approach is helpful.
Yeah.
With that.
Yeah. Perfect. Alrighty, so how do you know if you're done with therapy?
I would say this is one of the reasons we establish goals at the beginning, right? Like I always say, how will you know when you're done with therapy? And I want them to sort of think about that at the beginning of the session, right? Or beginning of our experience together. Like, and I always try to get tangibles like with this, like what will you be able to do? You know, well, I'll be able to get out of bed and get the chores done in the house. Like, okay, great. So when you feel that energy and that desire to get out of bed in the morning, get up and do those things, that's when you'll know you're done with therapy. Yep. Okay, great. So establishing that at the beginning is really helpful. Not just like a feeling.
Yeah.
Because a feeling can change and a feeling can be deceiving because you're always chasing after, like when I feel happy again. Well, what level of happiness do you want to feel again, right? Like if you're looking for this elated happiness, like that's not life and that's never going to happen. You're never going to be done with therapy.
Yeah.
So it's got to be like, well, when I can have these types of conversations with somebody, or when I can make it through a meeting without having to get up and leave. Like what's the tangible way that you feel like you could do that? So it's always good to assess, like, how is this affecting my life and what do I want to be able to do that I'm not able to do now?
Yeah.
You know, like if I can't say no to people, I want to be able to say no to people. I want to if you're in that people pleasing, right? Like I want to be able to voice my opinion when somebody says something different than me and be able to say no in those moments. Like how can I change that? And you know, and then we know we're done. So I would say you know you're done when you establish those kinds of things. Yeah. Also, I don't know if I'm unique in this as therapy, but I never like discharge somebody and say you're done with therapy. I call it an as needed basis. I say let's put you on this as needed basis.
Okay.
And so because life comes up and things will change and shift, and I say I feel like we're done with this thing, but let's put you on the as needed basis and you just make an appointment if you need it. Yeah. Like if something else comes up and you feel like something changes, go ahead and make an appointment. Oh, so smart. Someone doesn't feel like I'm done, I can never go back and talk to them again, or they're gonna think something's wrong with me because we resolved this issue and it's, you know, but
still have some struggles with it.
And that's okay. Like different life circumstances bring things up and it's okay to still struggle with that.
Yeah.
And have that change.
Yeah, that's so smart. Another thing, Nikki teaches me a lot of things I just don't think about. And then she says them and I'm like, that makes so much sense. But thinking about at the beginning, thinking about like, what do I want to, where's my end goal? What do I want to be able to do at the end of this? Or what do I want to accomplish? Like that's really smart to have that end goal.
There's the whole part of therapy too is awareness. Like sometimes we're just not aware of what's really happening. And when we bring awareness to things, we can make changes. So if we're not aware of our symptoms and how our symptoms are affecting our life, and then what we're choosing to do after we feel those symptoms, just bringing that awareness can change your life, right? Like, oh yeah, every time I do this, then this happens. Yeah. But I could do this instead. And sometimes therapists are able to bring that awareness. And so being aware of where you want to go can just change your life in general.
Yeah, definitely.
Not just let the wind sort of blow you around.
Yes.
Willy-nilly, wherever you want to go. Or let other people blow you around is usually where it lands.
Yes.
It's like other people are just blowing you around, and then you have no life that you want to live.
Yeah.
Because you're living what everybody else wants you to live.
Yes. I love that.
Yeah.
Awesome. Well, that was the last question
Nice.
on today's thing. Yeah.
Awesome. I say if you guys have other questions, please reach out on Instagram or email us. You know, we send out a weekly email to tell you what the podcast is about. Just hit reply to that. And we will answer any other questions that come up. If you guys liked this type of an episode, will you also let us know if you liked the Q&A back and forth and asking the questions, more of an organic conversation. It gets a little bit longer than the 10-minute episode, so I always kind of debate what do you guys like? Do you like the short 10-minute, like, quick, I'll just get in there and tell you what it's about, or do you like the conversation style more? Let us know. We're happy to make it work for whoever.
Yeah.
And what you guys
I
like.
love to hear the feedback, I'm curious what everyone would think. Yeah. And hopefully everyone likes these questions. Because obviously we're talking about therapy now, but yeah, it would be fun to answer questions or have Nikki, not me, have Nikki answer questions.
Yeah.
I would love to ask Nikki more questions because that's what I do all day is I'm constantly asking her questions.
It's awesome.
It's
awesome.
nice. Yeah. It would be nice to see if this is interesting to everyone, if they want
Yeah.
Nikki to answer more questions.
Yeah. We always want to make the podcast beneficial for you guys. So reach out. And the best way to do it, if you do like it, is to go leave a review. Because when you leave a review on especially Apple Podcasts, it pushes it out to more people and recommends it to other people. So leaving a review or you recommending it to some other people is really helpful as well.
Yeah.
Awesome. All right. See you guys later.
See ya.
Thank you for listening to the LDS Mental Health Podcast. I hope you were able to find ways of healing, guidance, and peace. If you liked this episode, please share it with a friend who would love to start thinking in a higher and holier way as well. Or hit that follow button so you don't miss out on any episodes. Also, check out the links in my show notes for other episodes you might like and links for other mental health resources on my website.